All right, we'll start with our last two vocab words for chapter 12. So make sure your homework packet out and copy these words down. If you need to press pause at any point to get needs more and more of a drug to get the same effect. With alcohol, it's a pretty easy situation because uh, you know to start with, I showed you the chart the other day of how many drinks it typically would take someone to get to 0.08 in terms of being drunk. And so a lot of people drink to get drunk, and as the tolerance increases, it's going to take more and more alcohol to get that same effect. So maybe let's just say it takes 3 drinks to get somebody of an average size and weight to get a pretty good feeling of intoxication. The more and more that they drink, the more they're going to need. So now, after several weeks, months of drinking, it's 4 drinks. Maybe a little bit later, it's 5. It's not going to keep going up to where it's 30, but it's going to take a little bit more over the course of time to get that feeling, and then really they're putting a lot of alcohol into their system. So tolerance, very much a real case with alcohol use. And number 10, intervention. You may have heard this term before because on the channel A&E, there's a whole show dedicated to the whole idea of what an intervention is. It's a gathering in which family and friends get the problem drinker to agree to seek help. So let's just say that this classroom is a combination of all my friends and family, and I'm the alcoholic. I think it would be pretty clear to most people that my drinking would affect those people around me. Maybe when I'm drunk, I'm not the most fun to be around. Maybe I am violent or abuse my family members. Maybe I steal from others. Maybe I've been in jail or caused accidents. It doesn't have to be necessarily drinking and driving. Maybe I've knocked over a mailbox or two, and people are worried about me. Or maybe I have been in jail. Maybe I have done some major crimes as a result of my alcoholism or drug use in general. It doesn't just have to be alcohol. So anyway, my family and friends get together with like a drug treatment counselor or a doctor or somebody who has some experience working with somebody who has an addiction to some sort of chemical. And basically, they set this meeting, and a meeting that we eventually would call an intervention. And you would invite me to this meeting. Maybe you would invite me to a backyard barbecue or a family get together or whatever. So I show up thinking that's what's going to happen. But when I get there, everybody's sitting around the living room or somewhere and ask me to sit down with them. Everybody there has prepared a written statement that they want to read to me as the person who's addicted, again, in this case, alcohol. And they go around and read their letters. And the letter is talking about how my alcohol abuse, it has affected their life. So when everybody's gone around the room, I will have heard from, it's usually, let's say, 8 or 10 people. It's not 30 like a classroom, but I've heard from 8 or 10 different people on how my addiction has affected their life. And the hope is that when they're done talking about it, I can really say, wow, yes, I do have a problem. I need to get help. And then agree to go to treatment or some sort of rehabilitation center or whatever you want to call it. And usually, especially on the TV show Intervention, they have a treatment facility already lined up and ready for that person should they agree. Now, keep in mind, it doesn't always go real well. You would hope that that person would be sober at the time and really see the true impact of their problem. But a lot of times people get upset, they get angry, they don't want to be told what they're doing is wrong. They think they have a control or a good grasp on what they're doing, and that it isn't a big problem. So there may be some yelling and screaming involved and some emotions, but uh, the hope is, and sometimes it has to happen a couple different times. The hope is that person agrees that they need to get help. All right, if you open up your notes packets to where we left off in chapter 12, lesson 3, we were talking about the long-term effects of alcohol use or abuse, and we were talking about in the previous slide how alcohol, when it is consumed, starts in the mouth and can be absorbed and can cause some cancers of the mouth and throat and things like that. Similar to what we might see with tobacco, but again, it's a chemical that our body really just doesn't want. And then it goes, as it goes through our basically our digestive system through down to our stomach, alcohol is going to irritate the stomach lining and increase the amount of acid there. If you ever had heartburn, heartburn is an increased amount of stomach acid that comes up the esophagus. It has nothing to do with your heart. It's not like your heart is actually burning or anything. It's just in the general location of your chest, of your heart. So that's where it got the nickname. But extra acid makes the lining red and swollen and can produce ulcers. And on the next slide, I'll show you what an ulcer looks like, but they're very, very painful. They're sores that can cause bleeding in your stomach, and certainly can be a problem long term if the alcoholic or the person continues drinking. Alcohol can also weaken the valve between the esophagus and stomach, which can allow for acid reflux or heartburn. If we look at the next slide here, this is kind of a cross section of your stomach. Here's your esophagus that comes down, from your mouth and throat, from the food we eat, down in your stomach. This is an ulcer. Imagine, how many of you have ever had a blister on your foot before, or some part of your body? It's like a blister inside your stomach where that top layer of skin is being worn away, and it can be painful. But instead of being caused by friction, because if you buy a new pair of shoes and it rubs against the back of your foot, that's where a lot of times we get blisters or something. This is caused by amount of stomach acid pooling in the stomach and wearing away that top layer of skin to where it is, bleeds or is painful. And again, there's normally a valve right here that kind of closes the stomach and stomach acid off and doesn't allow it to go back up the esophagus. Alcohol can weaken that, and then all of a sudden, you might burp and a little stomach acid comes up and it burns this sensitive tissue here, and that's what we call heartburn. All right, and these ulcers can kind of happen along the way in the stomach and gastrointestinal tract or your digestive system. Now, the liver is one of the biggest organs in your body that's affected by alcohol. I showed you the liver. I showed you dude's liver the other day in the classroom, but it really is like this big filter for your body. And alcohol is if it's frequently in the blood, liver cells can die. So imagine this filter here, constantly having alcohol pumped through it, and it's normally its job is to get rid of the impurities in the blood and in the food and things we eat. But if we overwork it, it's going to damage it, start to break down cell by cell, little by little. Now, this takes a long, long period of time, but it can basically turn this liver into fat, or it can it can lead to cirrhosis, which we talked about in our vocab the other day, and I'll show you a picture of that here in a minute. It just can be irreversible damage to this organ, and we certainly want the filter in our body to be doing its job. So again, cirrhosis being one of the things that can happen, it's a disease characterized by scarring and eventual destruction of the liver. It basically turns it into almost looks like hamburger. It's just totally beat up and rough and bumpy and no longer that smooth, healthy organ that is acting as that filter in our body. The scarring prevents the liver from doing one of its key jobs, which is removing poisons from the blood. Well, again, just small microscopic amounts, not like we're not talking about like you had a whole bunch of arsenic or a whole bunch of liquid poison or something like that, but there's traces of things in the foods that we eat that we don't want to be there that can eventually reach and damage the brain. So we want to make sure that the liver is again functioning properly in doing its job. So let's take a couple looks at what the liver looks like as a result of heavy drinking. Here's a healthy liver, very much like the one I showed you from Dude. Smooth, very healthy looking. Down here, this is a fatty liver. It's a cross section. It's not exactly the same, shape as this one, but it's very soft and it's a very fatty tissue. It's basically replacing good healthy cells with what we associate with fat. You can kind of see some different looks at the tissue here. But cirrhosis, look at that. That looks like it's been run over, put through a meat grinder. It looks like hamburger. I don't know how else to describe it. But this is every cell breaking down bit by bit over years and years and years of drinking. I would guess that this liver is probably 30, 40 years of heavy drinking, which seems like a long time. But, even divide this damage in half in 10, 15, 20 years, and that's still pretty significant. Now, of course, the brain being the most important organ you have in your body along with your heart, We know that alcohol plays a very destructive role in your brain when somebody's drinking heavily and continues to be addicted to it. Alcohol disrupts the part of the brain responsible for memory and problem solving. A lot of you, been taking you took the MCAs here recently, both English, or I should say, reading and math, and imagine what your scores might be like if your problem solving and memory were affected. Alcohol essentially destroys brain cells. And when I say destroys, it's not like they disappear, they shrivel up and die, but they are essentially rendered useless. They may still be there living and breathing and taking in oxygen and nutrients and things like that from the blood, but they don't do their job. So, if big pockets of brain cells start to die off, that's really going to have an effect on a person's day-to-day life. And brain cells can't grow back. It's not like we're going to get those. You think about, you get a cut on your arm, or bruise or burn, your skin can heal, your body, in certain parts of your body, will regenerate cells and heal itself. The brain can't do that. Alcohol can also block messages sent to the brain. This can cause problems with movement, vision, and hearing. So, you think about what we've talked about, reaction time. It's the same type of thing. We're blocking messages that your brain might be sending to muscles or to other parts of your body to react or act in a certain way that might be good for protection or might be getting you out of trouble. And certainly we want your body to be functioning the best that it can. Talking about driving while intoxicated, if you look at the kind of first letter of these three words, we're talking about DWI here. Now, driving while intoxicated is DWI. DUI is driving under the influence. Both terms can be used interchangeably. A DUI may also be used for different forms of under the influence of chemicals or drugs, such as marijuana. It doesn't just refer to alcohol. But my buddy who's a police officer has told me, it doesn't matter who you talk to, we're basically talking about the same thing. Just some statistics here. In 2005, 16,000 people were killed in alcohol-related crashes. That's about 39% of all traffic deaths that year. So you can really multiply 16,000 by 2.5. You're probably talking about 40,000 people, having died that year in traffic violations, or traffic crashes. 16,000 related to alcohol. That's a huge number. Those are crashes that probably, for the most part, could have been prevented. Should somebody have made a better choice and not used alcohol. And you think about it, passengers, pedestrians, and other drivers are all potential victims of a person who is driving while intoxicated. It could be a person on the side of the road. It could be it could be a whole host of different people who are out there. And a lot of times, drinking and driving is related to binge drinking. We're talking about a long-term effect. Binge drinking is a large consumption of a large quantity of alcohol in a very short amount of time. This is what can lead to alcohol poisoning. It's a big problem for teenagers. Some of the risks that include are deaths due to falls, drowning, or drunk driving. Again, people falling in lakes. I told you the story about the guy who was swimming across the lake after graduation. Somebody could be walking next to a river, they're drunk, they fall in, they get caught up in the current, they can't keep their head above water, and they drown. That's just very easily can happen for somebody who is drunk and not kind of keeping track of where they should be and away from bodies of water and whatnot, or a pool for that matter. Pregnancy or contraction of sexually transmitted diseases due to sexual activity. High school and college kids, this is a big problem. Two kids, a guy and a girl, are at a party, they get drunk, they hook up, they have sex, and maybe the girl gets pregnant, or one of them has an STD or an STI, sexually transmitted infection, and that can be passed around, all because they were drunk and made the basically quick decision to have sex with each other. You could also be a victim of violent behavior, get in a fight, somebody else could beat you up, somebody could be angry, you name it, and certainly deaths due to alcohol poisoning. We've certainly discussed that. Alcohol and teen pregnancy, a big problem. So let's say somebody does get pregnant, a female, male, hey, they don't have the long-term risk of having a child to worry about, although they may have to raise that child, which, for somebody who's 14, 15, 16, that'd be a big deal or a big problem. Unplanned pregnancies are sometimes a long-term consequence of alcohol use. Inhibitions are conscious or unconscious restraint of a person's own behavior or action. This is one of our vocab words. You know how you're supposed to act in certain situations. If you're drunk, you may make the decision to have sex with somebody, not use protection, or uh, again, normally maybe you wouldn't choose to have sex and be able to prevent a pregnancy or avoid one. And here we are because two people weren't, under their full capacities and weren't thinking well enough to make the right decision. Many teenagers do make poor decisions while they're drinking. Research has shown that a third of teenage unplanned pregnancies were alcohol related. That's a pretty high number. Which, then we have somebody who, and maybe we're talking about a teenage girl who doesn't maybe know she's pregnant for a few weeks or months. And, you would think they would know. There's a lot of reasons and signs and symptoms that would point that direction, but maybe they continue drinking. And we know a lot of pregnant adults will continue drinking when they're pregnant because they're addicted or because that's what they like to do. And that can lead to fetal alcohol syndrome. Again, one of our vocab words here. Everything that female eats or drinks can affect that unborn baby when she's pregnant. And then we're talking about fetal alcohol syndrome as a group of alcohol-related birth defects that include both physical and mental problems. FAS, another kind of shortened abbreviation for fetal alcohol syndrome, can lead to lower birth weights, problems with the heart, brain, and kidneys. We're talking about a child who will not function as well as everybody else because of the decision of his or her mother to drink while pregnant. The child has no say in this. It's not their fault. The mother is really the one who ultimately makes that decision. My buddy who's a police officer was telling me a story where a few years ago he works the night shift. In the middle of February, he's driving around in Elk River and he comes across this woman walking home from the bars late at night, like 2 a.m. And he recognizes who she was. He had dealt with her previously. And so he pulls over and offers her a ride. Well, of course, she's about 8 months pregnant and she's sloppy drunk walking home, having just been at the bar. So, he just drives her a couple more blocks or whatever she had left home, and so she can get home safely. He's doing the right, nice thing. Well, being pregnant, that's a pretty scary situation. The very next night, he's working, and at 2 a.m., he's driving around downtown Elk River, and guess who he sees walking home again? The same woman. And she this time, not only is she pregnant, but she's got her 2 or 3 year old baby in her arm with her. Took the baby to the bar with her. These children have no say in the matter. How scary of a situation is it that they have to, basically do whatever their mom wants? These kids don't stand a chance. And she was pregnant with number four. All right, this wasn't just one and two. This was number four, and she's only like 25 years old. And my buddy would just shake his head. He's like, "What do? You can't arrest her, but at the same time, it's wrong, and it's just a scary situation." If we take a look here, here's some of the things that we're going to notice with a child that's suffering from fetal alcohol syndrome. Start down here with the brains. This is a brain of a baby, a normal healthy baby at 6 weeks old, and this is a baby with severe fetal alcohol syndrome. All right, look at what are some of the things you notice right off the bat. I would say the size of the brain. You can imagine a child with a brain like this is not going to be able to function as well as this one. Some of the symmetry, basically usually both halves of the brain should be similar in size and shape and things like that. We don't see that here. We don't see the clear divide that we do with the one on the left, on the one on the right. Just a lot of different problems going on here. And if you look at the top right here, there are some things you can look at in a child who has fetal alcohol syndrome that might be telltale. They have a very thin upper lip. They have a smooth philtrum, that little flap of skin kind of between your nose and mouth that really doesn't exist. They have an upturned nose, railroad track ears, kind of some parallel lines here, and a flat nasal bridge, and a couple other things. But I don't want you to look in the mirror and start suggesting that maybe you have these things, because genetically, people can have some of these traits. It doesn't mean you have fetal alcohol syndrome. We're really looking at a combination of kind of two of these problems, along with behavioral and mental and emotional issues that result from just the damage to the brain while that child was developing.